Sydney. I'm a student nurse. Today I'll be inserting a catheter in you as per doctor's order. I'm going to close the door and wash my hands and do my hand hygiene. Can you verify your name and date of birth for me? I'm going to check with your wristband to make sure it's correct. It is. And I'm going to get everything set up. I'm going to get my kit. I'm going to charge around, so I open it and wait for me first. Make sure you're staying in the 1-inch border, not touching anything that's inside. Okay, now I'm going to turn this around. Place this between the legs that I propped up. Now I'm going to get my gloves, but I don't want to reach over the stair rail, so I'm going to move this down a little bit. And then I'm going to get my gloves. I don't need this. Pick it up and we're still sterile. I'm going to toss that aside. I don't need the covers. This is we're doing it on a female. Now I can actually, I'm going to put my hands in the middle where it's sterile, with the sterile on sterile. And then I'm going to turn this around. And get everything ready. I'm going to open my alcohol swabs. And then I'm going to make sure, are you allergic to latex or iodine or any shams or seafood? No? Good. And so I'm going to open up my alcohol swabs, and then I'm going to open also my lube and lubricator, and then I'm also going to put it in here, or for per ATI, I'm going to put it in here. Now I'm going to open unwrap my catheter. I'm going to do the coil method so it doesn't flop outside the sterile area. Okay, now that's in. I'm going to put that in the lube. And then I'm also going to, I'll have that. I'm going to open my sterile water and cap it and connect it. Now I'm going to take everything and put it in the sterile field. Okay, I'm going to clean the area first. So I'm going to spread the lips, starting away from me, up, down, around the knee, drop. Again, the one closest to me, up, down, over the knee, drop. And the last one's going to be the middle, up, down, over the knee, drop. I don't need the alcohol swabs anymore, so we're good on that. Now we're ready to insert. Everything is ready, and the catheter has been looped up, so we're good on that. I want to make sure when I insert, I don't touch the lips with my sterile hand. Insert it through the urethra. Okay, as I see urine, so I'm going to go in 2 more inches. Okay. Now I'm going to pinch the catheter with my non-sterile hand now because the sterile part's over, and keep it in there to make sure it does not fall out. I'm going to insert 5 to 10 mLs of sterile water. Okay. I can take that off now. And now I'm going to do a little tug to make sure it stays in. It does. Now after that, I'm going to take I'm done with the sterile part. I'm going to take my bag, drop it over their knee, and I'm going to make sure to hook it. I'm going to hook it on the bed, on the bottom of the bed where the bed is not leveled. And then I'm going to use a chair as an example. I'm going to hook it down here. Oh, sorry, Foley catheter broke. So technically it's supposed to stay in here. Sorry about that. Okay. I know I broke the sterile field, but I'm done with the sterile part anyways, but my thing is broken, so it won't stay in. So after that, I'm done with everything. I'm going to take off my gloves in a sterile manner by pinching on one side, dropping it, or, sorry, let's go back. I'm going to coil it with one hand, and then I'm going to put it, get underneath this glove without touching the dirty area and dropping it. Now I can wrap everything together, and then I will throw it away. Hi, I'm Sydney. I'm a student nurse. I'll be taking out your Foley catheter. I'm going to close the door and do my hand hygiene. Can you verify your name and date of birth? Okay, and I verified with your wristband, which is correct. I'm going to put on some clean gloves. Okay, I'm going here. I'm going to look at your output. I'm going to note everything I see. I'm going to unhook this at the bottom, and I'm going to get the container, and I'm going to drop it in there, and I'm going to undo it. I'm going to push the blue button, the blue button onto the other side to let it drain. Okay, after that, I'm going to stop it and put it back up there. I'm going to unhook it over here and I'm going to put it back on the bed so it's easier to access. Oh my gosh. And then I already put a towel down so nothing will come out or anything. But I would also make sure I have my syringe so I can take out sterile water so I can deflate the balloon. So I'm going to push it back here, and I'm going to make sure to take out the amount that I put in, which was 10 mLs. Okay, after that's done, here, and then I'll have you take a deep breath. I'm going to slowly pull it down. Okay, after 3, 1, 2, 3. And slowly take it out, an easy slip. Okay, and make sure everything is good, and make sure there's no, and just looking at the area, just make sure there's no wetness or anything, and I should clean the area too. And after this, I would dispose everything into the biohazard. Okay, I'm also going to take off my gloves. And did you have any questions or concerns today? All right, well, I'll let the doctor know, and have a nice day.